you for joining us once again. Today on Sonography Arena, we are going to discuss a case of a 64-year-old man who presents with a lower abdominal distension and a bladder outlet obstruction. On ultrasound, we noticed a moderately enlarged prostate and a hyperdistended urinary bladder with a trabecular wall. We also noted a circular outpouching from the wall of the urinary bladder with a connection into the urinary bladder. The outpouching in the wall of the urinary bladder represents the herniation of the mucosal layer of the urinary bladder wall through its muscular layer, and this is referred to as a urinary bladder diverticulum. The circular outpouching is referred to as a diverticula. Now, you notice the difference in the thickness of the wall of the urinary bladder and that of the diverticula. Now, the wall of the urinary bladder appears trabeculated, okay, compared to the wall of the diverticula, which is smooth and thin. For us to fully understand what happened in the case of urinary bladder diverticulum, let's quickly look at this diagram. And this represents the urinary bladder wall, which has 4 layers. We have the mucosal layer, which is the inner layer. We have the submucosal layer. We have the muscular layer, which is the destructor muscle, and then the subserosum layer. Due to some circumstances, the muscular layer of the urinary bladder, which controls the contraction during your urination, becomes weak, which leads to the herniation of the mucosal layer through it, resulting in the formation of the urinary bladder diverticulum. Urinary bladder diverticulum can be congenital or acquired. Congenital urinary bladder diverticulum is seen in children, while acquired urinary bladder diverticulum is seen in elderly, just like a case we are discussing today. Acquired urinary bladder diverticulum occurs secondary to chronic urinary bladder outlet obstruction. When there is a urinary bladder outlet obstruction, the pressure required to achieve a maturation increases. In order to meet up with this increase in demand of pressure required to expel urine, the urinary bladder wall, which is responsible for generating the pressure required to expel urine through its contraction muscle, will now undergo modification. So, and this modification will lead to the thickening of the urinary bladder wall. Okay, the thickening of the urinary bladder wall is referred to as urinary bladder wall trabeculation. Now, if the obstruction is not removed, the urinary bladder wall will continue to stress itself beyond its limit. It will continue to overwork itself, trying to generate enough pressure that will be required to expel urine to a point that it can no longer bear the pressure, and then this will now lead to the herniation of the mucosal wall, which is the inner layer of the urinary bladder, through the muscular layer. So, and then this is now lead to urinary bladder diverticulum. Unlike the urinary bladder, The diverticula has no muscular wall. So, and this will lead to the continuous retention of urine within this diverticula, and this will make the diverticula to continue to increase in size over time. So, because there is no muscular wall that is required to generate pressure that is required to expel urine from this diverticula, it will continue to increase in size. In the case we are discussing, the obvious source of obstruction is the moderately enlarged prostate. When the patient was asked to void, he could not achieve any menstruation. So there is a complete retention of urine. There is also a secondary bilateral hydronephrosis, which is due to the obstruction of the outflow of urine. In summary, a hyperdistended urinary bladder with a trabeculated wall is noted. There is a huge circular outpouching from the wall of the urinary bladder, representing the hydration of mucosa through the muscularies of the urinary bladder wall. And this is referred to as a diverticulum. There is also a presence of enlarged prostate and bilateral secondary hydronephrosis.